Thank you, and I'll tell you to you, Mark, and to Margaret, I just feel that this is a second home. I just love being here, and the work that you do, you know, just caring for, working with young people, working with children, and the health care that they need. And one of my big fears is, and it's not the subject of the premium subsidies, but the big beautiful bill is the cutbacks in Medicaid, the $1 trillion in Medicaid, and that is going to reverberate to community health centers. That is really the fears. We're going to see community health centers like where we are standing here today with all of the services that it provides, that there's going to be lessened resources. That means less help that you're going to be able to provide. And in some cases, in some places, these health centers are going to close. They are going to close down, and we cannot let that happen. So I'm grateful for all the work that you do, and you can be assured that we are going to fight like hell to make sure that we can continue those resources so that you can carry out these services. And Kristen and Charlie, thank you. To my colleagues who are here, none more ferocious. Honestly, you know, we got warriors here who are not afraid to stand up and make the fight. And I want to say a thank you to you, Mayor, your interest in kids and their health, which is what we should be all about. And so thank you so much. And Matt, you know, unbelievable work at the State House. And this is a local, state, and federal effort to understand this, let people know about it, and fight for it. And that is what we're trying to do. We're here today because Connecticut families have run out of time. You've run out of time. Mm-hmm. The president's refusal to extend premium health care subsidies, a refusal to absolutely, he's preferred to shut down the government, to shut it down, rather than sit down and talk to us about all of this. And this is why we're here, because of this effort. I'm going to introduce Renee Chalice, who is in my district. She joins us from Milford today. But Renee, along with 143,000 other people who purchased coverage through Access Health last year, are no longer receiving the tax cuts to help cover those costs. For Renee, and she'll tell you her story in a moment, this means she could have to pay over $2,000 a month to keep her insurance. There are thousands more like Renee who are receiving these notifications of their premium hikes, and the total average monthly premium increase across the 3rd Congressional District is nearly $2,700. For those below 100% of the federal poverty line, if you're a family of one, it's about $61,000. It is nearly an almost $1,500 increase. Our position today is crystal clear. It has been from the beginning of this shutdown, is to stop Renee's premium from skyrocketing, stop what's happening to Kristen and to Charlie. And what Democrats want to do is to prevent, it's a cost of living crisis. People are experiencing a crisis. So many bills, housing, electricity, groceries, but health care costs are at the top of that list. And that's happening to working class families, middle class families, vulnerable families. And so what we want to do is to prevent more than 20 million Americans from suddenly see their health care costs skyrocket. Now, you know, this is incredible, where you have the Speaker of the House saying that we can put this conversation off. First of all, open the government, and then we'll talk to you about it. Well, as I said before in these occasions, if we believe that, then I've got a bridge I want to sell you. Really do, because it isn't going to be there. And Kristen put it well. They're doing what they're doing, and they're telling us we can't move on these premium subsidies because it's too expensive. But they can do $4.5 trillion in tax cuts to the wealthiest and to the biggest corporations in this nation. And when the speaker says wait, you can't wait. You've got the notices. People have got the notices now. It is about open enrollment starting on November 1st. You have to make your first payment on December 15th. Otherwise, on January 1, you will not have health insurance. So have a happy holiday. Whether it's Christmas, Hanukkah, Schwanz, or whatever you're paying for, you're going to be overwhelmed with these costs. They made the $4.5 trillion permanent for the tax cuts. And they now want to tell us that we can't afford to pay for the premium subsidies. We could do $40 billion for Argentina, but how in the hell are we helping Kristen and Charlie and Renee and others? They make their priorities clear of where their conscience is. A piece of advice today: shop around, look at options, take advantage of the local resources, including CHCs, Center for Medicare Advocacy, all of the groups that are out there that want to help you. There's choices to take a look at how they can help you make the right decisions. This shutdown is really, it is the entire fault, starting with the president and the Republicans in the Congress. They control the House, the Senate, and the presidency. And just 3 days ago, our leader, Hakeem Jeffries, and the leader in the Senate, Chuck Schumer, wrote to the president, asked him to sit down with us. In a matter not even of 24 hours, he wrote back and he said, no. No. They're on vacation, 35 years, 35 days out of session, to which nothing can happen. So what we need to do, it's very simple, is lower the costs for health care, make sure that they stop the cuts that they have done to Medicaid, Medicare, etc. And what we're all about in this effort is saving our health care. And that's why I want to bring up today Renee Chalice, who is here, who will tell her story and her situation about where she found herself. Renee, thank you. Thank you so much for being here. Thank you.
Thank you, Congresswoman DeLauro, for inviting me here today to share my story. For almost 11 years, I've turned to Access Health Connecticut for health care insurance. As a freelancer and a divorced mother of 2, I have relied on federal premium tax credits to keep my payments affordable. Without them, my premiums will likely triple to more than $2,000 a month, not including co-pays and deductibles. Those tax credits have been a lifeline for me. The government recognized that people like me who work for themselves without an employer to cover for it still deserve access to affordable care. Years ago, I took on the risk of being self-employed, and it has paid off, and it's been a rewarding journey. But now, about 1/4 of my income will be handed over to a random healthcare company. When I worked for an employer, I never had to pay that much. Why should I now? Just because I work for myself. Some might ask, what about your children's father? Can't he at least provide health insurance to them? Sadly, he has fallen gravely ill in the past year, and tragically, he can no longer work or take care of himself. And actually, I had become his conservator of the person to support him during that time. And as for other family, my father lives with me and my children, but he's 85 years old, and he relies on Medicare. And as you can imagine, that's a whole other story. He too may be facing higher costs as well. Never in a million years did I think I would be in this situation. I was raised to believe that our federal government serves its citizens, not itself or other countries. So, excuse me, I wrote a note. So it feels as though the freelancers and entrepreneurs are suddenly invisible. It feels like a betrayal. Let me be clear. For me, the premium tax credits were never, were a necessity, and it was never meant to be a handout, or it never should have been considered a handout. They were a temporary stopgap solution to a much larger problem, the high cost of healthcare. My story is just one of many. Tens of thousands are facing the prospect, hundreds of thousands are facing the prospect of losing their coverage, their medications, their health, and their peace of mind. Like me, they are terrified of what the future may hold. What did we do to deserve that? I am thankful to Congresswoman DeLauro and to all of you here today for allowing me the chance to be seen and heard. I truly hope that together you can restore the premium tax credits for families like mine and for so many others who also need and deserve affordable health care. Thank you.